I wanted to ask you about this because you're a holistic dentist. And I know, I guess you're under obligation with the American Dental Association to not poo-poo root canals, but there's a lot of dentists that have tried to explain to me why root canals are so bad. So what could one of these naysayers on root canal, why do they say a root canal is so bad? Well, help me understand.
Yeah, sure. Root canals can be bad. It's a dead piece of tissue sitting in your body. It's been plugged up from the inside, and there's bacteria living around the bottom of the root of the tooth. We only have one other option, which is to remove the tooth. So therein is kind of the dilemma.
So root canals are for dying teeth or a dead tooth?
That's correct.
To just keep it there in place?
To keep it there and keep it functioning.
All right.
Okay. Now, the root canal does give off toxins into the body. So in a root canal, what we do is we go inside the tooth, you clean it out, and then you inject a sealer material inside the tooth, like a grout.
Okay.
Between every kitchen floor, you put grout between the tiles. So there's a grout material that's put in there that has metals in it. So those metals can't seep out the bottom of the tooth. In fact, there's a technique which deliberately puts a little poof of the material out into the gum tissue, into the bone tissue rather, down at the bottom part of the root of the tooth. So we know that's down there. One of the challenges is that harmful or not to the body? And I maintain that it is. So that's what a root canal is. The other thing that it does, it starts to kill the bone around the edge of the tooth. So you can have, just like a dead tree. You know what a dead tree is?
Yeah.
It's still there. It still looks like a tree, but it's not living. But you can build stuff out of it.
So it starts damaging the underlying bone?
Yes, it does. It kills the bone. That's the problem. So the dentists that don't like root canals, they just say pull the tooth, because that's
a safer way to go.
That's a safer way to go.
Because in your practice, you're a holistic dentist. You don't do root canals at all. You send them to a specialist.
I do.
Okay.
Because not everybody wants to have a tooth removed. They want to roll the dice and see where they are with the tooth.
Now you have techniques, because like you say, you run my show, you do everything you can to avoid a root canal.
We do. And so some of the techniques that we do, even if somebody has a root canal, I mentioned ozone, lasers. So we have tools that we can monitor
to
people.
disinfect the area if you are going to get a root canal.
I like to use the term we nurse the tooth along. Okay. And we want to nurse that tooth. If we have to keep a tooth that's unhealthy, let's make it the healthiest unhealthy. You got a laundry basket. You need a shirt. You want to pick the cleanest shirt from the dirty shirt pile if you have to put one on in an emergency. So this is, you're wanting the same analogy. You want to do what you can to keep something that's not healthy as the